In tonight's medical moment, there's been a lot of discussion lately about blood clots due to problems with the Johnson & Johnson COVID-19 vaccine.
But there are other medicines that may cause blood clots that you might not be aware of. Joining us is Dr. Mimi Munn, who is a maternal fetal physician with USA Health. Dr. Munn, thanks so much for being with us. I understand that birth control has been known to cause blood clots.
Yep, good evening. Thanks for having me. That's correct. There is a risk of developing blood clots with taking contraception, which occurs at a much higher rate than what we've seen with the COVID vaccine.
And how are the clots similar? How are these medications similar, if at all?
Yeah, there really is no similarity in the two medications, and the process of the clots and where they occur with the COVID vaccine, I think, are a little bit more concerning, and the association with a low platelet count that helps the blood to clot. So that was probably one of the reasons that they put a pause to look at it a little more closely and in detail.
So when we're talking about birth control, where do you see these particular clots? Is there a certain part of the body where they develop more frequently?
Right. So when a person develops a clot associated with birth control, we more likely will see these in the legs. Sometimes they occur in the lungs. So it's very serious, but it's not that what they're describing with the vaccine, which is occurring in the central nervous system, in the cerebral venous sinus area.
Are all blood clots dangerous? How serious should someone take the situation?
Right. Certainly all blood clots are very serious, and people should take them seriously. But folks who are contemplating the vaccine should also remember that COVID, the disease in and of itself, has been associated with blood clots. So that the risk of getting a blood clot from the vaccine is actually much lower than getting a blood clot if you have a serious case of COVID.
Right, gosh, so you get the vaccine, you could get a blood clot, you get COVID, you could get a blood clot. So is there a message here, Dr. Munn, should folks maybe consider an aspirin or something like that, or is there not a whole lot you can really do?
Yeah, there's certainly no data right now that there's a good way to prevent those blood clots that are associated with the vaccine. But again, we have to kind of keep it in perspective, I think, and the occurrence of these clots with the vaccine were, 1 in a million. So knowing that the disease can be very serious and very deadly, I think patients have to weigh that risk against the risk that there might be clotting. So it's just kind of an individual decision.
Dr. Mimi Munn with USA Health, thanks for the good advice and thanks for joining us tonight.
Thank you.